Welcome to ZOOMERTIMES TV. And here's your host, Anita Finley.
So everybody sit back, relax. It's going to be very, very important that you hear what Dr. David Sherrod has to say. He actually is an anesthesiologist, but retired, but not really retired with other things. He's just writing books like crazy, and he's into so many things. So it's such a pleasure to have you with us, Dr. Sherer.
Well, thanks for having me again. It's really good to see you.
Yes. So we have a lot going here, but I'd like to concentrate on your books first, because I said before, and I'll say it again, that your two books, which Hospital Survival Guide and What Your Doctor Won't Tell You, I think they need to be on your shelf, where if you own a Bible or if you own something really important, that's where they need to be. And I have to refer this because I have a friend that just broke her wrist. And I was telling her some of the things, when she went in, don't go to the hospital if you don't have to. Do it in one of these care centers, if it's a very experienced orthopedic surgeon specialized in wrists. And also about the medication. Don't be afraid to take the medication for the pain, because that's important for you. You're not going to be, as everyone's afraid, oh, I'm going to become an addict. So why don't you talk a little bit about that?
Well, there was a big movement in the 1990s and early 2000s about getting a handle on people's pain issues. And what happened was there was a little bit of overkill in that sense, because the drug companies and the doctors really pushed too hard for narcotic medication. And that's why we see the terrible result of the addiction crisis, where hundreds of thousands of people have died in this country from overdoses. So it really was a movement that was, I think, misguided, because the narcotics can have some terrible side effects, and among them are certainly the potential for addiction. So, there are a number of lawsuits now, and the pharmaceutical companies who make narcotics have been found liable for part of the epidemic, and they've paid a heavy financial price. But the point of the matter is there are other ways to handle pain than narcotics, and we can talk about that.
Yeah, I'd like to know that. I mean, she's taking Tylenol during the day, and then she takes a pain pill at night, and she doesn't want to take these things. But if she's in pain and she can't sleep, she's not that kind of a person, though, that she's going to be hooked.
The statistics showed that the average surgical patient left the clinic or the hospital with an average of 82 narcotic pills. And if you think about that, there's no reason anyone needs to have 82 narcotic pills lying around the house. And that's why we had so much addiction and so much drug diversion, because these pills ended up in the hands of young people and people who weren't meant to have them. So that's why you have these, part of the reason you have these terrible outcomes in overdoses. So you have to understand that women are more prone than men to becoming addicted after surgery for a narcotic addiction. They don't know why that is, but it's the truth. And so women have to be particularly careful about not becoming addicted to narcotic medication. So it's very important to look at other ways of treating pain.
Okay. Can you give us just a few tips while
Sure.
we're on that subject?
Sure. Narcotics are used because, let's be honest, a lot of times the doctors don't want to hear your complaints. I'm very sorry to say that, but doctors are very busy, especially now. And there was a movement in medicine to kind of satisfy the patient and kind of make them go away so the doctor could move on to other problems. And that's part of the unfortunate truth that I like to talk about. And so what we have to understand is there are other ways of dealing with pain, such as non-steroidal anti-inflammatory drugs like Motrin and Aleve and Toradol, and injectable forms of those medicines, as well as Tylenol. And there are also injectable medicines after surgery that can give you 3 or 4 days of pain relief, so you don't need a single pill. And one of those medicines is called Exparel. It's Exparel. And that is an injectable form of local anesthesia that lasts about 72 hours. So many people don't even need a narcotic pain pill after surgery when you have that medication available. So there are other ways to handle it.
And so what are the doctors doing that? Or, well, this is a very important question because I've never understood it. When a doctor prescribes medication, does he benefit from that?
Usually not. Exparel is not covered under all insurance plans, and it can be very expensive. I believe a single small vial of Exparel can cost a few $100s. So, but if you crunch the numbers, you find out that those few $100s are worth it, because if you can avoid addiction and the side effects of narcotic medication that include itching, nausea, vomiting, urinary retention, constipation, confusion, being prone to falling down. If you can eliminate all those possibilities, then you're actually saving money in the long run. So I'm a big advocate of using medicines other than narcotics to treat surgical pain and other kinds of pain. Now, cancer pain is a different kind of thing, because a lot of people with certain cancer diagnoses are terminal. And in my opinion, you should give those patients whatever they want. So.
I see. Well, when you wrote the book, What Your Doctor Won't Tell You, did you get in trouble with doctors? I mean, you know, you had all the credentials, but did you hear from them and they were not happy?
The opposite. I heard from them and they were thrilled, because I could say all the things that they've wanted to say but couldn't say. So the overwhelming majority of doctors who've contacted me through email, telephone calls, and my website, drdavidsherer.com, have given me a pat on the back, because their hands are tied as far as what they can say by who they work for, or the medical boards, or the hospital administration. But I can speak the truth. So they actually were very glad that I said what I said.
How long did it take you? And, you know, I don't know if you quite remember, to write a book like that, or were these notes that you have been compiling for years?
A lot of my material is based on the blogging that I did for Bottom Line Incorporated. A lot of people get Bottom Line Personal Magazine, and I used to write for them. And so a lot of the material is sourced from that, and I kind of rewrote it and expanded it and checked my research. So there's a lot of evidence-based research involved in those 2 books. And I think people would really benefit from reading it, because for the simple price of going to lunch, you could pretty much change your life and even save your life.
Absolutely. This is the book. This is the cover. And I attest to what Dr. Ferris said. Dr. Sherer said, I mean, absolutely, this is the book to get. And we have another one that he wrote. I mean, these 2 books could have taken 10 years, but apparently it didn't, but they could have. Hospital Survival Guide. You know, Dr. Sherer, people say, I don't want to go to the hospital. I don't want to die there. If I go to the hospital, I might die. Why do people feel that way?
Well, first of all, they hear horror stories about hospitals, and hospitals are not pleasant places. Hospitals are not a place that anyone aspires to go to. And I just wrote a recent article where hospital-acquired infections are a huge problem in the United States, because of many different factors, including how unhealthy the American public is. And you and I have talked about this before. 70% of Americans are either overweight or obese, and that leads to so many incredible problems like high blood pressure, being prone to cancer, arthritis, gastroesophageal reflux disease, heart disease, diabetes. It just goes on and on and on. So whereas a lot of illness is under our control if we can adopt a few lifestyle changes that are not that difficult. All it takes is discipline, and it takes commitment. And so if you're willing to put a little discipline and commitment in your life, you can make your life longer and better.
That's great. And how long have you been in this position of, I mean, were you ever fat or were you ever different? Was this when you were just a little kid that you thought about all these things and then went to
Well,
medical school?
no, I was much heavier than I am now. I used to be about 50 pounds heavier than I am now.
Really?
Yes, I was over 200 pounds, and
No.
yeah, I was. And I weigh 156, and I'm 64 years old, and I'm happy to say that I can still run 7 miles and bike 30 miles and go to my fitness class every day. And, Anita, I think you read that my late sister died of diabetes when she was 26 years old.
Yes.
And I have to say that that was an impetus for me to improve the lives of other people, because it seems such a shame that Americans are hell-bent on destroying their most precious asset, which is their health. And all the money and prestige in the world, and all the highfalutin jobs, and the Mercedes and the Bentleys, and all the condos in South Florida are not going to do you a damn bit of good if you're in the hospital and sick. So if there's one message I want to give to your listeners today, it is that you have a degree of control over your destiny. I'm not talking about your genetics, I'm talking about your lifestyle. And if you will put some effort and read my books, together they'll cost you about $29. If you read these two books, you will extend your life, you will save your life, and you will make your life better. I guarantee it. It's guaranteed.
And you can buy these books on Amazon.com, or you said you could buy it directly from you?
No, Amazon.com is a great place, or wherever books are sold. And
Okay.
I'm pleased to say, Anita, I talked to my publisher yesterday, and we've reached about 10,000 books in sales in just a few months on these two books. And I'm thrilled about that, because that's a respectable number to get a start with books.
Are you kidding? People would be thrilled to sell that many kind of books. But, even though, of course, you're going to make money doing this, it's not a lot of money, but it's knowing that you are helping people, because that's what you're all about. You've been that way. I mean, I've had the pleasure of talking with you, and I know where your heart is. And fortunately, you've had the medical experience. I want to get back to your being an anesthesiologist. What made you do that rather than doing some other kind of medical specialty?
Well, there are two reasons. Well, the first reason was it combined a great ability to use my hands and my mind in a way to help people with their illnesses, and using pharmacology and physiology to effect an immediate response to people so that they could be better. And number two, it was the desire to have the freedom to go wherever I wanted and not have to set up an office, because it's a hospital-based or a clinic-based practice as opposed to being an office-based practice. So I traveled all over the country doing anesthesia in places like Florida, DC, Maryland, Virginia, Delaware. So I could take my skill with me anywhere I went. I didn't have to have an office to do that.
Oh, yeah, that makes sense. Well, and I'm sure you're the type of a physician that you want to talk to that patient, if at all possible, if they're not in dire situation, before you put them under anesthesia, don't you?
Yes, and I always tried to get a rapport with patients. I had about 15 or 20 minutes before a procedure, and many of them said to me that I communicated more with them in that 15 minutes than their own doctor does, who they go to see 3 and 4 times a year. So, it's a great thing to be able to help people in an acute setting. And, I think I learned that from my dad, who practiced for almost 60 years.
Yeah, I'm sure that is true. That's the way it works. But let's, and I want everyone to really buy these books. I mean, there's nothing I could advise you more. And it's a perfect time. It's the holidays. What a nice thing to send, buy, give to your family. And if you can't do that, get them a gift card for this. Just tell, because Amazon might be slow with it, but make sure that you have a gift card for your family and tell them what you're buying for them. But I
but
want to go.
Anita,
go-
think about it. We're in this pandemic. There's no better time than to have these books. There's no better time because healthcare is difficult enough to navigate. It's difficult enough to navigate the American healthcare system. If you have these two books, you're going to save yourself a lot of heartache. I guarantee it. It's guaranteed, because I tell you how to work the system. I tell you the inside story. I tell you the way to protect yourself and your family and your friends. You're not going to get this information from any other source. And I wouldn't say that if I didn't mean it 100%.
Yeah, and I agree with you. I'm so happy that I have those books. I've had to look up a few things for some friends of mine already. I told them to get the book, and I should be buying some of these books because they, they go on this. They're so quick to go on Google and ask questions, but it's not the same as getting into these books. You were so specific. You had done so much research. There are indexes. It's so well done, Dr. Sherer, and I really thank you. As a matter of fact, I want everyone to know that he was our book of the month. Well, they were books of the month. We put in all three, and I'll talk about the last one, into our November issue. This is, you have that one. That's what it was in. And I'm going to hold up the hospital survival guide a minute. They're beautiful books, and they're not small. They're big, they're heavy. There's lots of information. They're paperbacks, but they're worth the weight in gold, really. Well, let's also now move into something else. So as Dr. Sherer is so proficient at medical deals, he also is I guess he's a behind the scenes, or not anymore, author of mysteries and novels. And his latest one, which we featured, we did a review of this, was spectacular. And he used his knowledge to do this. It's called Into the Ether. Ether is what you get when you're under, right? Ether. So Into the Ether. Well, when did you get that idea to do a novel when you're so busy with all these medical information pieces?
Well, I knew that we had, as anesthesiologists, a tremendous power over patients to get them to either go to sleep or be sedated. And so I thought, well, if you could sedate an influential patient, almost like with truth serum, that patient could start talking and giving information that normally wouldn't be divulged. And so that's what that book is about, some privileged information that gets brought out during a sedation while the doctor's alone with the patient. So you read the book and you know where it goes from there, but I think people would enjoy it.
It's a novel. It's not real. The only reason it's real is because an anesthesiologist with all that knowledge knew what happens, but it goes further than that. You did not, I don't think you were trained for all the mystery and all the information with the FBI and everything else that got into that book. How did you get all that?
Well, researching things is so much easier now with the internet. So I did a lot of research about financial markets, the Securities and Exchange Commission, the FBI, and the CIA, and foreign governments, and where to have privacy in banking. So I was able to kind of put this all together in a story that I think people would enjoy.
Did it scare your wife when she read it? I bet she said she probably
No.
didn't know who you really were.
No, she knows all too well who I am. So it's no, it didn't scare her. It just confirmed what she already knew about me, I think.
So, at the end, it's interesting when you read a novel and there are people in it who you shouldn't like, but you do like, even though they're bad guys or girls. And I liked the man, the protagonist. I liked him.
Well,
but he certainly he had quite an ending, and I would like to know what happens after the ending. Do you know?
No, I know because I'm writing the sequel now. So yes. So I know what happens in the next step, but But I'm glad you liked it. You know, not all of the people who read the book like the protagonist, so it's interesting to see how people have different opinions. So,
Well, I liked him because he had a reason for what he was doing. It made a lot of sense. And then even, I won't go into this, there was a very personal reason that wound up in this book that was a surprise to me, but that was good that you put that out. And that was a little true in your life too, wasn't it?
yes, there is a personal angle in the book, and of course, they say write what you know. So, a lot of what's in the novel is almost true to life in my own story. So, it's almost a bit of biography there. So.
Right. And so this is called Into the Ether. Now, this is a great novel, and I think that it's something you'll want to buy, because as we started off before we even got on the show, talking about Omicron and all these vaccines and everything that's happening, you have a lot of time at home. Turn off the TV, for heaven's sakes. Sit and read something, cook, do things that are different. But I think that I'd like to talk a little bit to Dr. Sherer about this vaccine and the people who aren't vaccinated and the Omicron and what's going on. Can you spend a little time with us on this?
Yeah, well, sure. Let's start by understanding what vaccines are. You know, there are vaccinations for about 25 existing diseases that have been, in many cases, decades and decades and decades in existence. And the overwhelming evidence is that vaccines are safe and effective in preventing death and disease, period, end of story. So I can understand the public's apprehension about a vaccination that was developed very quickly, but what you have to understand is millions and millions of people have received vaccination regarding COVID-19, and the number of adverse events or catastrophes you can count pretty much on one hand. So if you have tens of millions of people vaccinated, and the overwhelming majority of people who are vaccinated do not get seriously ill or die, the medical evidence is very clear about this. And I get reactions when I get vaccines to the shingles and the flu shot and to the COVID vaccination. I get flu-like symptoms, but that one day of flu-like symptoms is worth the protection that you get, you know?
And
So
let me jump in here. I get no reaction other than a sore arm once with it. I get no reaction, and I get everything up to the booster, up to the flu shot. I do all that. And so I don't get anything.
well, did you know, Anita, it's interesting, there's no correlation between your reaction to a vaccine and its effectiveness. There's no correlation. So even though you get no symptoms and I get a flu-like symptoms, we will get the same protection afforded by the vaccination. You would think it would be otherwise, but the medical science shows it doesn't matter. So even if you don't get a reaction, it doesn't mean you're not protected. The overwhelming number of people who are getting sick right now are unvaccinated people. It's just a fact. It's not a conspiracy. It's not a story. It's not a fiction. It's true. And if you go to states like Vermont and Wisconsin, you find that the ICUs are filling up with people who have not been vaccinated. They're dying and they're very sick. And none of those people in the ICUs, pretty much, almost none of them are the vaccinated people. So the evidence is there. People have to get over this nonsense. I mean, look what we did with polio. Polio doesn't exist anymore. And smallpox doesn't exist anymore. It just doesn't exist. And why do you think that? Because we had vaccinations for a lot of these medical problems. You don't see diphtheria anymore. You don't see measles that much anymore, although you have a few outbreaks. The point I'm trying to make is if there were 24 or 25 diseases virtually eradicated from vaccination, why are you so distrustful about it?
I have no idea. And I'm so glad that you, whom I respect, and I'm sure so many people who will be watching this respect, the books you wrote, who you are as a physician. It just says so much. And I hope that people do listen. And I've tried now not to be with anyone who's unvaccinated. I'm not taking a chance.
Well, I understand what you're saying. And during this whole pandemic, I really did not have any personal fear. And the reason I say that is, first of all, yes, I could have gotten sick and I could have died, and I still might die. But here's the thing. I try to take care of myself. I'm at a proper weight, and I try to eat right, and I try to exercise. So what am I trying to say? I've done everything that I can to protect myself, and I have to live my life. I've traveled abroad 4 or 5 times. I go to restaurants. I go see friends. I get the vaccination, and I live my life. You can't live in a bubble. You can't live in a bubble. But if you take care of yourself and get vaccinated, you vastly increase your chances of being well versus not doing those things. And here's an interesting point, Anita. In countries where the obesity rate is high, the death rate from COVID is 10 times the amount than other countries. Did you know that in Vietnam, it has the lowest death rate of any country from COVID? Do you know why that is?
No.
The answer is their overweight rate is 15%. 15% in Vietnam. The old enemy that we fought in the 1960s, the Vietnam War, they have 10 times less COVID death than we do because they weigh so much less in Vietnam. And the science is clear, but we Americans, we don't want to hear it. We don't want to hear it. It's too politically incorrect, and that's a shame.
Oh, that's very interesting you brought that up, because most people have never heard that before. I mean, we know people shouldn't be overweight, but that's a very interesting fact. Well, I just want to tell everybody, we did feature Dr. Sherer, who is, he's really such a marvelous guy. I mean, I can't stop talking about it. It's Dr. David Sherrod, Sherer. And you can get his books, Hospital Survival Guide, What Your Doctor Won't Tell You, the reasons you don't feel good and what you can do about it. It's very important. And the best thing he's done so far, if it's not medical, is Into the Ether. And he's working on another one, but it's a great novel. And you will want to get that also. So I certainly hope that you enjoy your, how long are you going to be down here in South Florida?
Oh, on and off for a few months. And actually, I'm having the pleasure of visiting Barbados on Sunday with the ambassador from Barbados to the United States, who is a friend of mine. So I'm looking forward to that.
Oh, that's going to be lovely. And they just, aren't they the ones that are no longer part of the English crown?
Yeah, that's exactly right. They just had their first president, a woman. Both their prime minister and their president are women, which I'm very happy to say is a great thing. And I congratulate Barbados on becoming a fully independent republic with a president. And Prince Charles was there in Barbados as a kind of a formal visit to kind of accept the handover from the crown to an independent nation. And I give my wholehearted congratulations to Barbados for achieving this great thing, and I wish them all the best.
And how is COVID there?
It's not bad. It's not bad. And as a matter of fact, I think that it's well under control, and they have a good system of keeping track of people. You know, Barbados is not a big country. And I think that countries that are smaller have a better ability to deal with this than, say, a nation of 360 million people like the United States. But here's an interesting thing. I heard today that in the United Kingdom, in England, if you have a cough and sniffles, you are more likely to have COVID than you are the common cold. That's how bad it's gotten.
Okay, so people, please listen to that and take care and be good. And Dr. Sherer, we would like to thank you very much. You've been terrific, and we look forward to doing this again with you. I just always enjoy your coming on. You're so smart and so nice. That's what I love about you. So take care of yourself, your beautiful wife, and your family, and we'll talk again.
I can't wait to see you again, and I can't thank you enough. And you're the best. I'll see you later.
All right. Thank you, Dr. Sherer.
Thank you.